I'm Dr. Steve Hotze. Welcome to Health and Wellness Solutions. There's an epidemic that's sweeping the nation and affecting the health and the well-being of millions of men and women. Hypothyroidism is the most misdiagnosed, undiagnosed, and unrecognized health problem in America. As women approach midlife and their hormones begin to wind down and become imbalanced, they are in serious jeopardy of developing hypothyroidism. In fact, women are 7 times more likely than men to develop hypothyroidism. This puts their health at serious risk. With me today is Dr. David Sheridan and Dr. Don Ellsworth from the Hotze Health and Wellness Center to discuss the reason your doctor may not recognize hypothyroidism. Doctors, thank you so much for joining us today on our program.
It's great to be here.
Great to be here.
Many individuals go to their physicians with classical features of hypothyroidism that go unrecognized or misdiagnosed by their doctors. What is the reason for that?
I don't think doctors are trained. I know I wasn't trained to see hypothyroidism as a clinical diagnosis as opposed to a laboratory diagnosis. I was trained it's a laboratory diagnosis. And what we're really finding out is clinical history and physical are huge.
And the symptoms of hypothyroidism are fairly large, aren't they, and fairly broad. To get a good history, how long would it take a physician to spend with a patient to be able to find out what's going on?
It takes time, and that is a big part of our problem. We're trying to go too fast, and so doctors just want to hear your top 1 or 2 concerns. Hypothyroidism affects the whole body, and if a person is honest, they can fill 2 pages worth of symptoms, and the doctor needs to take a look at that and say, you know, this looks like hypothyroidism, and not just try and pick off the top 2 and give a drug that'll treat the symptoms.
Well, I understand currently physicians spend on an average about 5 minutes with each patient. So they really don't have time to take a full comprehensive history.
And I've actually heard several people recently tell me that they'll go in reporting all these symptoms and their doctor will say, well, can you just tell me your top 1 or 2, because they just don't have the time to address all their concerns. And in taking that shortcut, they're actually missing the diagnosis.
What are some other reasons physicians may not be able to diagnose hypothyroidism?
You know, with all tissues, all the cells and all the tissues being dependent upon thyroid hormone utilization, not just the supply but the utilization of the hormone, to act properly, my gosh, I mean, it's such a wide array of symptoms.
That they just don't really recognize the symptoms as being a constellation which indicate a thyroid problem.
And we've stopped teaching that. When young physicians are in medical school, they're going through the classes, they're not learning what to look for. They're not learning the symptoms. They're not learning the signs: low body temperature, loss of the hair on the outside of your eyebrow, the teeth impressions on the tongue, joint pain, muscle pain, all the different symptoms. They don't know it, so they're not thinking hypothyroidism.
You know, another problem is we call symptoms diagnoses. So depression is considered a diagnosis. Mm-hmm. It's really a symptom. It's a symptom of what? Many times it's low thyroid. So the muscle pain you talked about, fibromyalgia, it's a Latin word for muscle pain. So it's not a diagnosis, it's a symptom. And I think we really lose our focus.
Another reason I think physicians don't recognize hypothyroidism is they are not cognizant of the fact that hypothyroidism is a hypometabolic state. It lowers a person's metabolism, and therefore one of the classical features that we see with low thyroid patients is low body temperature. They usually have sensitivity to the cold, oftentimes cold hands, cold feet, but routinely in a hypothyroid patient, you can do a body temperature when they come into the office, and you're going to find their body temperature is going to be below the normal, which would be 98.6. So I'd say we did a study of the last 200 guests that had come here to the Hotze Health and Wellness Center, and we looked at their body temperature, and their average temperature on coming to the office was 97 degrees. That's over a temperature 1.5 degrees lower than you would expect to find in a healthy patient. So basal body temperature is oftentimes overlooked, or body temperature is oftentimes overlooked as a means to diagnose. What other reasons might you find?
Well, the tyranny of the TSH is a huge issue. Doctors think that when they see a TSH, or a thyroid stimulating hormone level, within the normal range, that they've excluded the possibility of hypothyroidism. That's a huge mistake. Hypothyroidism can be tremendously present at the cell level and have a completely normal level of this regulatory hormone. Doctors are not aware of that.
You know, another point is different people can have totally different individual normal ranges. So to tell a patient anywhere in the range is okay for anybody is like saying any speed between 5 miles an hour and 70 miles an hour is perfectly okay anywhere. And we know that's not the case. So we're individuals with different individual norms, and these ranges, they're population statistics, they're population ranges, not medical ranges.
And those ranges are as really tall as the Empire State Building, wide as the Grand Canyon. They incorporate 95% of the population. So anytime you get a blood test for a TSH, for instance, or a free thyroid level, you're looking at the population range, and wherever 95% of the people fall within that range, that's considered normal. So, and I can assure you this, 95% of the people that go into a physician's office requesting a thyroid blood test, they don't feel normal. In summary, there are at least 6 reasons your physician may misdiagnose you or not recognize the fact that you have hypothyroidism. First, your physician may not be trained to even think about hypothyroidism. Secondly, it takes an enormous amount of time to collect a good clinical history from a patient, and most physicians just don't have the time. They only spend 5 minutes with a patient. Thirdly, physicians may not understand all the various clinical symptoms that a patient has that relate to hypothyroidism. Fourthly, there are physical signs that patients have on a physical exam that the doctor may not recognize as indicative of hypothyroidism. Fifthly, low body temperature is a sign of hypothyroidism, and most physicians do not realize that. And finally, your physician may rely strictly upon blood tests to diagnose hypothyroidism and completely discount your clinical history and your physical examination and your body's temperature. So those are 6 reasons your physician may not diagnose hypothyroidism. And it's important for you to find physicians that will listen to you and that are well-schooled and well-trained in evaluating and treating hypothyroid problems. I hope you found this video informative. Be sure to join our email list, and once a week we'll send you a video highlighting various topics regarding women's health, hypothyroidism, natural hormone replacement, and numerous other pertinent videos regarding your health. If you have any questions regarding your health, please email us at drhotze@drhotze.com or call to have a free consultation with one of our wellness consultants at 877-698-8698. That's 877-698-8698. We're excited to have the opportunity to get you on a path of health and wellness so you enjoy a better quality of life.